Ptosis Worsening at 24. I've always had a drooping in my left eyelid and was even present in pictures from when I was a child. However, up until now, it never really gave me trouble other than cosmetic. Now at 24 years old, I feel it may be worsening. Recently, I've been having headaches on that side and discomfort and more of an overall puffy feeling on that eyelid. Also, the conditions seem to degrade with fatigue. Basically, I'd like to know if I should see a doctor. Can it be corrected with surgery?
Thank you for your question. Based on your question, you've described your eyelid has always been droopy since you were a child, and that recently, at the age of 24, your eyelid has been drooping further, and you've been developing some symptoms such as headaches on that side, and you're asking if you should see a doctor. Well, whenever you have symptoms that are constant, the way it appears based on your question, the answer is yes, you should see a doctor. What I'm going to share with you is some of my experience with congenital ptosis and help you understand what options you have moving forward. So, assuming that you were born with this drooping eyelid, there are majority of people who have that history have something called congenital ptosis. Ptosis means drooping, so it's congenital eyelid ptosis. Now what that means is the muscle that lifts your eyelid did not develop the same way as the normal eyelid, or the eyelid that has no droop. It means that muscle doesn't fully contract, nor does it fully relax. So when we deal with congenital ptosis, if the child doesn't have a visually significant ptosis where it's affecting the visual information before the age of 6, then correction can be done at a later time when it's more of an aesthetic issue or a functional issue. Now, one of the things that happens with congenital ptosis is that it can get worse as people get older, as the facial structure changes. And one of the things that we also observe is that a lot of times the compensation that people do when they have a drooping eyelid is to raise their eyebrow. And very often, especially when the skin is more tight, you're able to more effectively raise the eyebrow and lift the eyelid. As you get older, there's a little bit more stretch, and that compensatory action doesn't work as well. It's very common for people who have had a long history of ptosis to say it's worse at the end of the day. One thing to also be aware of, in my experience, is that people who have ptosis are particularly bothered if that eye that is being affected is their dominant eye. There is typically in everyone an eye that is the preferred eye, where the brain wants to see out of that eye, and it's referred to as ocular dominance, or the dominant eye. So it is possible that the source of your headaches is related to the activity of the muscle called the frontalis muscle that raises your eyebrow, having some tension and spasm. Again, my recommendation is that you see an ophthalmologist as well as any other doctor if the ophthalmologist can't give you a full explanation related to your headaches and your symptoms. Now, assuming that everything is clear and that you're ready to have a procedure, then eyelid surgery for congenital ptosis is typically, except for the type of ptosis which is severe with poor muscle function, is typically some type of surgery on the levator muscle. The levator muscle is the muscle like the word elevator, but without the letter E, that lifts your eyelid. And generally, when I deal with adult patients with congenital ptosis, I do something called the Levator Advancement. This way, I can move the muscle forward, but not sacrifice any of the muscle if I can avoid it, and in terms of a resection or a shortening. So that type of procedure is done so that the eyelid is at a more appropriate level but in normal social interaction. Remember, that muscle doesn't contract or relax like a normal eyelid muscle or the normal levator muscle. So it will be variable in terms of when you look down or when you look up. So 9 out of 10 times people are very happy when their eye looks good, when they're looking straight ahead. It looks good for pictures. It doesn't draw attention in a social situation, and it works out pretty well. But it's important to understand that there is a possibility that the eyelid during that kind of surgery can be too open, too low, or not have exactly the ideal contour. So in my practice, I always tell my patients that 95% of the time works out great after one surgery, but 5% of the time you may need enhancement, and that being said, you may need more than one enhancement. So you have to understand that going into making that decision. So again, most likely you'll benefit from a cosmetic or a Levator Advancement procedure to lift the eyelid, and if it does affect your vision, then there's a functional component to it. But please see a doctor about investigating these symptoms you're having, and once all of that is cleared up, do some further research and find the right oculofacial plastic surgeon to help you with your drooping eyelid. I hope that was helpful, and thank you for your question.